Okay. So today I'm going to be performing routine tracheostomy care per our unit's protocol. I would put on my clean gloves. Open my basic tracheostomy care kit. Remove my sterile field. Only touching the 1-inch borders. And then I would empty the contents of my tray onto the sterile field. I would remove this container, and I'm going to check my saline. I'm going to see that my saline, I'm going to check the expiration date and see that my saline is not expired. I would palm the label of my saline, open my saline, and pour it into each container. Then I would recap my saline. And I would go to my patient. I would remove his oxygen therapy, remove the inner cannula, and place the inner cannula into the first basin. I would then replace the oxygen therapy and remove the drain pads. Normally that would not happen. I remove the drain pads and place them in the trash can. Then I would remove my clean gloves, glove to glove, skin to skin. I would perform hand hygiene, and I would don my sterile gloves. And then I would remove the inner cannula. Oh no, I would arrange my contents on my sterile field. And then I would remove the inner cannula. I would grab this, and I would clean my inner cannula. I would clean both the inside and the outside. And I would place the inner cannula into the second basin now. And I would discard of the sponge. Next, I would take the inner cannula out of the basin, take gauze and dry the cannula, discard of my gauze, and I would take the pipe cleaners and use my pipe cleaners to dry the inside of the inner cannula. and then I would throw the pipe cleaners away. I would now take my inner cannula back to the patient. I would remove the oxygen therapy, and I would place the inner cannula back into the patient's tracheostomy, starting at 9 o'clock and then moving to 6 o'clock, and then place it back in. I would now take the cotton swabs, dip them into the third basin, and clean around the stoma. So first I would clean the inside of the stoma to the outside of the stoma. So I would clean closest to the stoma first, and then discard of the Q-tip. Then take the next Q-tip, dip it in the basin, and clean the outer portion. And then I would discard that. I would now pat the stoma dry with a gauze, just lightly pat it dry. And then I would discard that. And then I would check underneath the trach collar for any redness, erythema, or skin breakdown or anything like that. And then I would replace the drip cloth. And replace the oxygen therapy. And now I would remove my sterile gloves. No, I would do the trach ties. First, I would attach the new trach ties before I remove the old trach ties. So I will use my and you tie this into a knot. And then you would lift the patient's head and put this under. And then tie it again. Mine is too short to reach to tie around my box, my patient. So, but normally you would tie it again, and these would help when you tie it, so that way you wouldn't be pressing on the carotid artery while you are tying the trach ties. So then you can untie the old trach ties, now that the new trach ties are in place. You would now remove your sterile gloves, glove to glove, skin to skin. And you would do a respiratory assessment, and you would put clean gloves on before you did the respiratory assessment. But then you would put on your clean gloves, perform the respiratory assessment, compare it to the respiratory assessment you did in the beginning, and you would perform oral care. So you would either use a toothbrush or a cotton swab, like an oral swab. You would use chlorhexidine rinse, and you would then reposition the patient to a comfortable position. You would make sure the head was at least 30 degrees elevated. You would lower the bed as low as it goes. You would put the side rails back up and make sure the patient is comfortable. You would then remove your clean gloves, glove to glove, skin to skin, and you would document first the trach suctioning. You would document the type of secretions that that were drained. You would document how the patient handled the procedure, and you would also, and then for trach care, you would document that you performed the procedure. You would document the type of document if there was any skin breakdown, any erythema, any edema underneath the trach collar. You would document how the patient handled the procedure, and you would also document the type of and size of the tracheostomy tubes. And now I would remove my PPE. So to remove PPE in a proper order, you remove your gloves, you remove your goggles, you remove your mask, and you remove your gown. But to remove your gloves, goggles, mask, gown first and then mask. So you would remove your gloves, which I've already removed my gloves. Then I would remove my goggles, and if I were to be wearing a gown, I would remove my gown, and then I would remove my mask. And then after that, I would document.